A bladder catheter risk is one I never would have considered an issue going in for a heart procedure, but it definitely happened. In the last video, I was just preparing to go in for a paravalvular leak closure procedure, which I had last Tuesday. And after the procedure, I was back in the room. I used the porta-john by the bedside, and it was black. Now, I know just enough about medical stuff to know that that's a bad sign, that urine should look like diluted lemonade and not like you just changed the oil on your chopper. I called the nurse immediately. She looked at it, started making some calls to the doctors, and the next day I saw that it was more of a bright red stain to it. So I knew that it was still fresh blood coming into the urine stream. The big concern about seeing blood in urine is the question of whether or not you will actually form a clot in your bladder from the blood that could potentially block the urethra. So to mitigate this risk, on Wednesday morning, they inserted a bladder catheter, which was one of the most unpleasant experiences I've ever had. Worse than any tattoo or piercing. 0 out of 5 stars, would not recommend. That's the first time I've ever had one awake, and it was rough. However, if a clot were to form in the urethra, that would make it way worse, is what they told me, because at that point they would have to manually irrigate, which means actually pumping fluid by hand through the urethra into the bladder. After they inserted the catheter, they had it plumbed up so that I would be rinsed with saline bags and still have the drain tube on the other side. So let's take a look at what the plumbing looks like for all this. All right, so let's pretend these are the twig and giggleberries. And basically, back here you have your bladder, and you have your prostate, and you have these two streams feeding together that come in here, and what they're doing is they are shoving this catheter, which is about the size, probably about a 5/16 diameter, is what they shove inside here, super unpleasant, and go up into the bladder, like that. Then what they had out here is there were 2 saline bags up here that would gravity feed at an adjustable rate here down into this. So that fluid would come down with head pressure and rinse the bladder, and then coming down here out of the catheter was basically a catch bucket where the fluid, not only the body's urine being generated up here from what you're drinking, but this fluid rinsing it out. So what you'd see is this fluid caused it to be pretty light in color, relatively speaking, but when you actually had fluid coming in from your body and your intake, that would shoot a little bit more blood into the system. They were going through about 1 saline bag an hour. They were constantly changing bags, emptying the collector at the bottom. They had to record the color and the quantity of the fluid coming out. Also meant that I was basically tied to the bed because I had an IV pole on one side with the saline bags, and then I had the little catch pouch on the other side of the bed. So anytime I wanted to get up and move out of the bed, I'd have a nurse come in and help me move everything along. The surprising part of all this is that my hemoglobin numbers were good. And hemoglobin numbers would generally indicate, oh, you have internal bleeding, right? Somewhere out here, there's this source somewhere of blood that's making its way out and into this. And hemoglobin should be saying, hey, there's internal bleeding, but my numbers were actually okay, which was a good sign because that meant that the bleeding was fairly minimal overall. And if you think about it, it doesn't take a lot of blood to stain a large amount of urine, and so it can probably look worse than it actually is. But needless to say, we're still seeing bright red, frank, they call it, blood in the urine, which is a concern. Now at this time, I'm on Plavix, which is a blood thinner, and I'll explain that more in the next video, because of the plug they implanted in my heart. So whatever is causing the bleeding here is going to have a lot harder time clotting and healing itself because I'm on these blood thinners. So it's kind of a perfect storm of problems. When the doctor on the floor came by, I told her I did have a urologist and gave her the information so she could begin to contact him about what to do with my issue. That Thursday night, they had to move me across the street to a different facility within the same network so that the urologist was able to treat me. So the next morning on Friday, the urologist came by the bedside and explained that they were going to do a simple procedure called a cystoscopy, in which they would go in and they would basically find the blood spots and cauterize them, which means basically burn them out. So that was the plan. He said it's very simple. They do it all the time. I did ask him about potentially the enlarged prostate, because everybody in the hospital had been asking me, do you have an enlarged prostate? I had no reason to believe that I did, but that was one thing that he said he would also check. I did have my PSA numbers checked earlier in the year, and those came back good, but the lesson here was that PSA numbers have to do with prostate cancer. That's a separate issue from just having an enlarged prostate, which is what they were thinking might be the issue. And so with this, you can see that if you have an enlarged prostate, then it might be a tighter fit here, which means shoving that catheter up there could break loose something here, tear the wall, and cause bleeding here. So the bleeding was either coming from somewhere in the prostate or in the bladder. The procedure itself was only about 45 minutes, and I woke up in recovery, and then they quickly moved me back up to my room. The rest of the day was spent recovering in my room. There was still a little bit of blood, especially the first couple batches that came out into the bag after the procedure. Still quite a bit of blood in them, but as the day went on and they continued with the rinse with the saline bags, the color got better and better throughout the day. The next morning, the urologist came by to check on me, to release me. He looked at the color, he said, yeah, that's about pink lemonade, that's about what we want to see. He did have him shut the bags off because the bags coming into rinse can actually, it skews your results. He wanted to see, what does this look like just naturally coming out of his body? So we had to shut that off for a while, let the natural color come out. Again, he said it's close to pink lemonade, that's fine. He said that what he had to do is there were several spots in the bladder that he had to cauterize. So he basically sealed them up and got rid of those. He said the prostate was only slightly enlarged. And when I asked him, you know, I've never had this issue before, I've had plenty of procedures, kind of just a bad luck thing. Somehow in the process of inserting the catheter for the heart procedure, the fact that I was on blood thinners, just, you know, it was just kind of bad luck, unfortunately. But regardless, he had him fixed. He said I'd be urinating a little bit of blood for a while, recommended not to go back to the gym or really strain myself until the urine was perfectly clear again. Now, one unfortunate part of this is I kind of fear that every time I go in for another heart procedure, this is just going to be a risk. I don't know that it's any higher risk than before. The fact that this is the first one I've ever had, is it likely the next one would be an issue? I don't know. I'll have to worry about that when the time comes. At least now, if I do see blood, I'll know, hey, here's what we have to do. I've seen this before. We have a fix, not a big deal. Shortly after lunch on Saturday, with the catheter out, a whole lot easier coming out than going in, and cleared to release from the hospital. Took my paperwork. The hospital actually got me an Uber for the way home, so I didn't have to pay that out of pocket. And I was back home with the dog soon after. Pretty much laid around the rest of the day like that, which is fine. Having gone in on Tuesday morning for the heart procedure, I really should have been out Wednesday morning, but instead, 3 days later on Saturday, I'm finally getting out. So it's pretty cliche when you think about it. Your heart leads you in, your prick gets you in trouble and causes problems. But the important thing is I was finally back home with the dog, in comfort of my own bed, able to get a good night's sleep without things beeping at me or needles stuck in me. Back home, still urinating a little bit of blood, but it is slowly improving. And again, you have to remember that a little bit of blood stains a lot of fluid, makes it look worse than it probably is. This is something they warned me about. They also told me, hey, because you're still on the Plavix, which is a blood thinner, it's going to take longer than it normally would. The fact that I've had a 5/16 tube stuck up my urethra for a few days also makes it just feel weird down there. I can't speak for how females would feel after something like that, but as a guy, everything just feels strange. You're not used to using your muscles in there to choke off the flow and control it anymore. And you've had this tube in there for several days, so everything just feels weird. And there's sort of a panic almost of every time you go to the bathroom, you're just anticipating it's gonna hurt somehow, and it doesn't. Again, it's just different, and it takes some getting used to being back to normal. I was prescribed tramadol for pain. Not big on pain meds, had bad experiences with those before, so I just got by with aspirin instead. I didn't feel a need to resort to those. I figure if I can stop taking all pain meds within 3 days of open heart surgery, I probably don't need them for a catheter. It'll eventually get back to normal. Right now, just focusing on drinking fluids, keeping it diluted. One pro tip: in trying to keep it diluted, do not drink an entire gallon of apple juice, which is 12 servings, or it'll wreak havoc with your stomach, trust me. My next task is to schedule a follow-up appointment with the urologist, which I'll do today or tomorrow, and just follow up, see how things are progressing and everything, make sure there's no concerns. The biggest concern still, and it's not as great of a concern, but the biggest concern is still that could blood form a clot inside and cause some kind of an issue and block the urethra. So that's the main thing I have to look for. Now, fortunately, we never saw any clots in the urine, so that's good. The other thing I'm doing is obviously drinking a ton of fluids, whether it's BCAAs or just water. The paperwork they gave me at discharge specified that things like caffeine and alcohol irritate the bladder. So if you already have a spot like this, that's not the thing to be drinking. Fortunately, I don't drink caffeine or alcohol anymore. So I've just been sticking to mostly clear fluids. Cranberry juice is something you can drink, but that may skew the color of the urine, and I want to make sure that I'm getting accurate color readings. The problem with going to bed at night is that you're not pounding fluids as you sleep, or you're going to get up every hour to have to go to the restroom. So in the morning, you'll expect to see a little bit more blood than you do during the day while you're constantly taking in fluids. If you haven't done so, please subscribe to the channel, click the little bell for notifications, check out the YCC merch store, see if there's anything you like, and let's live for today.